This is a demo of OpenSea Labs Navigator product for healthcare and social service providers, and also the care portal for patients or their clients. So this is the intake module where you would find this in a waiting room for a primary care or federally qualified health center or hospital. It's highly customizable. We can add social determinants of health assessments. Like here we have the accountable health communities. And now I'm going to jump into the patient dashboard. So here, Laura Shoemaker, she is a care manager. And here we can see both the programs that she has helped her client apply for, or the clinical or social services that she's made referrals to, and the status of those referrals, whether they're pending or appointment schedules. If she wanted to help Susan access some of these programs, she would just click on that, and here we can see, based on Susan's goals, like she's trying to prevent Susan from being evicted, she's getting certain recommendations of programs that will help her achieve those goals. And then we have some programs that she's eligible for and we're ready to apply. And if we wanted to just say learn more about one of these programs, you just click that. Here we can see the nearest organizations and information about this program we can refer, and again, this is organized by the proximity to where Susan lives. So we can make a referral, and these referrals can go out to anybody with email. So it's not limited to just paid users of OpenSea Labs. Anybody can receive a referral from an OpenSea Labs and create a free account to at least track that referral. Now I'm going to go to, I'm going to show you a few more things about this particular module. So if we wanted to help her client apply for a program or screen for a program, you just click begin screening, answer a few questions, and then based on that, we can get their eligibility for that program. When she's ready to apply, we're just going to hit the apply button. And what we've done is, before anybody was using this product, OpenSea Labs has taken the very same government forms, and we have generated this web responsive form. And you're going to see that this is simulating what kind of data would be auto-populated by autofilling the application form from data from an electronic medical record. You can see it's almost entirely autofilled. So this allows us to provide automation for the provider without having to integrate with 30 government agencies. We're using the very same processes that government accepts these forms, and that's how that product works. We can then fax it automatically from the screen or download it, and the person can take in the form and apply, and the patient can apply in person. So that is the Navigator product. The last section of the Navigator product I'm going to show you is the population health section, where you can see applications submitted and program enrollments for individual government programs, and then with the referrals we can see what the status of these referrals are. Are they making the appointments, and the types of programs and services that are being accessed. The platform was really built to foster partnerships between clinical and social service providers and government agencies. So here we have, let's say, Mount Sinai and their partners, and so Mount Sinai could then review kind of what providers, what partners are helping their patients access what programs and services. We can sort by date or export this data to Excel. Now I'm going to jump in very briefly into the patient side of the application. we call the care portal. And here you see that Susan can see the goals set in concert with her care manager or case manager, and she can set her own. And much of the functionality will be the same for Susan. One of the exceptions is that oftentimes when patients apply for programs like supplemental nutritional assistance program, they have to provide information on household income and the other members of their household. And so what we do is we generate profiles for those family members on the fly, so that based on that information provided, Susan can help members of her family access services too. So it's kind of like a caregiver's platform as well. Finally, I'm going to kind of show you the map view of the services. It's really built around the patient and where they live. Here we see where Susan lives, and she can explore services that are near her. She can if she wanted to use the search here, she could just type in type of care she is looking for, and that is OpenSea Labs. Thanks.